I add so many things to the dictionary so that it doesn't autocorrect.
Yeah. This is me oftentimes. I said what I said.
You're arguing with the bot.
Here I am arguing with more robots. This is my life in 2024.
Oh, man. I think it's all of our lives, unfortunately. Hello, everyone, and welcome to our favorite part of the week. It's time to listen to Sounds of Health, where we share the stories, people, and resources that help others to improve their physical, emotional, and financial well-being. I'm your host, Dave MacNiven, and today I'm excited to welcome our guests, the team from Soleil Acupuncture and Naturopathic Wellness. The team at Soleil is dedicated to providing a holistic approach to healthcare, focusing on the integration of Eastern and Western medicine paired with integrative and naturopathic principles. Lyndsey, Christina, Briana, welcome to the show.
Thanks for having us.
We're excited to have you.
Yeah.
I'm very excited that you have challenged us by having a three-person podcast.
It's what we do best.
It's amazing. So if you are joining us on Facebook Live, we are streaming live here. If you are on the stream, feel free to comment, say hello, let us know that you're listening. And we're going to get started. Obviously, I appreciate you guys bearing with us to figure out what the setup was going to be this morning, because this is a little bit different, but Jason was able to figure it out pretty well, I think.
Yeah.
And now you can do this moving forward.
Exactly. See, you challenge us to adapt, and now we can do more, which is a great thing.
Exactly.
So we usually start the podcast with just an icebreaker question. So I'm going to pose it to all three of you, and you can answer it one at a time. What makes you happiest these days?
Ooh, I got into golf recently.
Nice.
And I didn't think that I would really ever get into it. I always thought it was slow moving. But when you get into a field like this, you need to get out of your own head. Mm-hmm. And it's a very humbling sport. So if you think you know everything, you do not.
Completely.
So yeah, but I'm also learning it's becoming an expensive hobby because I keep losing golf balls.
We're going to talk more about that for sure. I definitely relate.
I think being a newlywed, coming up on my 1 year anniversary in
Congratulations.
September. Thank you. And spending time with my husband and our dogs.
Fantastic.
Yeah,
I love that answer as well.
We do a lot of traveling, a lot of hiking, and it's been a lot of fun.
That's great.
Mm-hmm.
I would say I've been going on some more frequent walks with my dog and just slowing down a little bit. And with all the nature that's been blossoming this summer, it's been really nice to just look at the leaves and not do much else, be in the sunshine.
Yeah, for sure.
So, yeah.
I have two dogs of my own. Neither one is a good walker. So they're fantastic. We have a fenced-in yard, thankfully.
Okay.
So, but we do take them for walks every now and then, and both of them have challenges.
Yeah. They take time.
Yeah, but that is great. Great. Well, thank you so much again for being here. I want to talk about what the business is and what you guys offer and what you do. Because I know there's so much that you do. I mean, just looking from the website and then speaking to each of you in the networking that we've done. But before I do that, can you briefly just tell me, what your background is and how you got to where you are today?
Sure. So I guess the funny part of the story is my bachelor's degree is in political science. So I was planning to be a lawyer at some point. And then once I graduated with my degree, I graduated in 2010, which was just after the 2008 financial crisis. So what was happening was we were finding that jobs were really hard. So I went and I worked as an administrator for a little while, and I found my brain kind of shrinking. And whereas I know most people are okay with just kind of going through the day-to-day, they get a paycheck, they get their benefits and all that, it just wasn't lighting me up and it wasn't fueling me. And I was only 23, so I was like, This is going to be a really long road for me if I continue on like this. So when I tell you I grabbed every higher ed, standardized test book to study, the GMAT, the LSAT, the GRE, the MCAT.
Just to see what was going to light your fire.
Yes. And then I read through an article that basically said because of the financial circumstances, most students that graduated around the time I did were finding them to be human inventory in these graduate schools because 6 months down the line, your student loans are due.
Of course.
So everybody's now trying to harbor into these havens,
Yeah,
so to speak.
keep the education going.
Keep the education
Yeah.
going, but also bar and keep away the student loans for the
Right.
time being. So I was like, all right, I can't just get into this because that's why I'm doing this. So I had gotten sick. I am plagued with chronic sinus infections. When I went to the University of Arizona, and I did grow up in Connecticut. So when I went there, it wasn't until I came home and was home for more than 2 or 3 months at a time that a sinus infection happened. And I realized I hadn't had one in over 4 years.
Oh, wow.
While I was there.
Yeah.
So it was whatever the environment was there was kind of keeping at bay. And then when I came back. So anyways, I called the health center. They told me, hey, like you have to wait for it to get worse before we can maybe potentially see you. Talked to my boyfriend at the time. And he's like, well, why wait? Why don't you just be proactive now? So I did like my own independent research. And eventually within like 2 weeks, it cleared up. It was a little bit of a long time, but I noticed that they were happening far and fewer in between. And so being really pleasantly surprised by that experience, I did my own research and was like, wouldn't it be great to like do something that you love that's along these lines? Mind you, I was also working in a medical school and I was seeing what was happening in medicine and science. And I just was very disenchanted by it.
Yeah.
So I found the American Association of Naturopathic Physicians, and there were at the time, I think 8 schools, one of which was the University of Bridgeport in Connecticut. And I wasn't in a position to relocate at that time. So I was like, Bridgeport, like in Connecticut, like for real, you know,
Yeah.
Didn't think so. So I ended up meeting with the program directors and coordinators and just ended up kind of moving on from there and haven't really looked back ever since.
That's really amazing.
Yeah.
So you were working at a medical school,
I
you
was,
said?
yeah.
Okay. And you were disenchanted with what was going on there.
Mm-hmm.
And then you found another path. That's
Yeah.
amazing.
So it was also interesting because I think I was also approached with the, I guess, potential adversity in
Yeah.
that setting as well when I told the professors what I was looking to do.
Gotcha. Okay. So there's a little pushback on that.
Yeah. So I was already kind of welcomed into the realm. So I'm used to this kind of back and forth. And so really what Soleil was born out of was this concept that it's not one or the other, it's both. And both can work together in harmony. And there's no reason that they shouldn't.
Gotcha. And just to tell people, what is your role with Soleil?
So I'm the director of the clinic. So I opened in 2020, which is also a weird time to do that too.
For sure.
But Christina was still in the hospital at the time, and I'd asked her what her thoughts were on kind of doing something together.
Yeah.
And kind of, again, weaving in the Eastern, the Western, the integrative, and the functional, and the allopathic.
Fantastic. Christina, how about you?
So I have always known that I wanted to be in medicine. When I did my bachelor's degree, I did pre-med, and I was working at Yale doing some clinical research, and a very close physician friend of mine at the time, I had taken the MCATs and I was applying to medical schools. And he was like, there are other options out there, just not sure if you even really know about them. Maybe you should shadow some of the nurse practitioners in our clinic. And at the time I had thought that I wanted to practice in oncology, and shadowed some of the nurse practitioners, got to see what they really did. And I was like, I mean, you have your own patient load. You're making independent decisions. You're totally autonomous, incredibly, incredibly bright women. And I was like, this is fantastic. I applied to one program, which was the MSN program at Yale. And I never looked back. I got in.
That's amazing.
Yeah. So I did the acute care track. I have always been an adrenaline junkie. I'm very good in a crisis. And I was like, all right, I'm going to harbor that skill set. Primary care wasn't necessarily the most interesting thing to me.
Right. Yeah.
So as nurse practitioners, you choose tracks, whereas physician assistants, they're trained equally and they can kind of do whatever across the life spectrum. Nurse practitioners choose a specialty. I'm like, well, family's not really my thing. I'm not really that interested in primary care. I knew I wasn't interested in pediatrics. God bless the people who do that. Psych also wasn't my thing. I was like, well, I'm going to go for acute care. I like the hospital environment, So did the acute care track at Yale. And then when I graduated, I took a job at Hartford Hospital. It was great. I did vascular surgery up there for almost 7 years. And my role changed throughout the 7 years that I was there. What also changed was COVID. And I think that has taken a significant toll on a lot of providers. who started their practice before COVID and practiced through it.
Of course.
The burnout was really, really real. The amount of time we were working. And, Lyndsey kind of, alluded to the fact that medicine is changing, and it is. The landscape of medicine is changing greatly, and I do think it kind of started around COVID. It probably started before that. I think, we have a lot of chronic health conditions, especially in this country. It's surprising for, one of my patients once said to me, we are the richest, poorest country ever. And I was like,
I've heard
wow,
that before as well, yeah.
That resonates. Like, that's incredibly accurate. And all of these incredibly bright people that we have in this country, all the money that we have in this country, and we're still one of the sickest countries.
Yeah.
So I'm working at the hospital, working a lot of hours. Lyndsey says to me, I think I'm going to open up my own clinic. And I was like, we don't know anything about doing that. And she was like, no, it's fine. It's fine. It's going to be fine. It's going to be fine. And so in the state of Connecticut, nurse practitioners can be autonomous in their practice after 3 years or 2,000 clinical hours.
Okay.
With a signature of a collaborating physician. And so I worked with absolutely incredible surgeons up at Hartford Hospital who were like, yeah, so happy to sign off on you being an autonomous provider.
That's amazing.
Started off, and my love for functional medicine grew, and to just become well-versed in everything, I furthered my education by getting a functional medicine certificate as well. And that's kind of what brought me here.
So a couple of questions. Can you just define acute care, that track?
Yeah. So acute care is really exactly what it sounds like. So people who are in the throes of a critical illness. So it could be an acute heart failure exacerbation. It could be an acute surgical issue. It could be, people that need to go to the emergency room with an acute infection. So primarily acute care nurse practitioners function in the hospital, but it does extend to specialties.
Okay.
Yeah.
So it's really something's happening.
Yeah.
Which is what it really matches up with your personality of being able to handle a crisis.
Yes. So truly, when Lyndsey talks about marrying both sides of medicine, like there is very much a place for acute medicine, right? Like people have a need. Like I'm telling you right now, if I'm septic, get me to the hospital and get me those IV antibiotics, right? If I need surgery, get me to the hospital and get me that surgery. I don't want to use the hospital as my everyday care.
Right, of course.
That's not where I want to be maintaining my health and wellness. And that's where this sect of medicine kind of comes in.
Gotcha.
Yeah.
Okay. And then functional medicine.
Yes.
How do you define that?
Functional, holistic, integrative, they may all be used interchangeably.
Okay.
But essentially it's more of the naturopathic model and not the allopathic. So you're looking at more addressing root cause, right? You're looking at not just looking at labs for normal values, looking at labs for optimal values. Are you symptomatic? And what are those symptoms coming from, right? Is it psychosocial, emotional? Is it truly physical? So really drilling down to root cause and treating that.
It's a very holistic approach.
Yeah, and it's the idea not so much of giving a pill for each ailment. It's really drilling down as to like where is this coming from, and helping people make true diet, lifestyle, overall changes to their health. Right. Don't get me wrong, there are people who need to be on medication.
Of course.
1,000%. Perhaps though there's people who can treat their pain with acupuncture. There's people who maybe have been told, well, your labs are normal, there's nothing wrong with you, but they are actually quite symptomatic, and we can address that.
Interesting. Okay.
There are people who just say, there's nothing, I've tried everything, I can't lose weight. I've done everything in my power and I just can't. Well, what's the problem? Do you actually have small intestinal bacterial overgrowth, and that's why you're holding on to weight? Is it actually hormonal weight? Are you not eating the right things, eating them at the wrong time? Are you super inflamed by something else and it's making you hold on to weight, right? Like there's so many other explanations.
Right. And very specific to each person.
And so you just made the whole point
Yeah.
of holistic, integrative, functional medicine.
Well, I'm good like that.
It is, it's not a protocol. We're not using protocols to
Gotcha.
treat patients. Yeah, do protocols guide some of what we do? Certainly. But at the end of the day, you are not Lyndsey, are not me, are not
course.
Briana, are not
Yeah.
Jason. And we all require approaching things a little differently
Yeah.
to treat the person.
Right. Now, what is your role in Soleil?
Yeah, so I am there doing IVs. So people who want to get hydration, additional nutrients. We also do injectables like CoQ10, NAD, B12, methionine and acetylcholine, B12. All of these things can kind of help with energy, weight loss, general health and wellness. I have people who say, I have no interest in taking my vitamins every day. I'd rather come to you once a month and get a bag. And if that works for them and their energy is good, then perfect.
Right.
Also, my newfound passion in the last 2 years, I would say year and a half or so, is medical aesthetics. Absolutely obsessed with it. I think our brand is very much minimally invasive, non-toxic, and being able to offer things to women and men that otherwise would not have pursued anything because they don't have any interest in undergoing plastic surgery. They don't have any interest in using synthetic fillers or neurotoxins or something like that to make aesthetic changes.
Yep.
But do want to, we have a lot of people who are coming in to see us. They're doing the work on the inside, right? They're doing the work to heal on the outside, the inside, and they want the shell to match.
Right.
Right?
Yeah.
And it's not vain. It's human nature, and very much everybody has the right to that. So we do things like radio frequency microneedling for fine lines, wrinkles, age spots, scar treatment, general lifts, hair restoration, PRP. We're doing, I never in a million years thought I would do fillers. Never in a million years, right? I was like, no, I wouldn't do it. I'm not going to offer it
Fillers
to my
meaning
clients.
Botox?
Synthetic hyaluronic acid is usually the common one that they're filling with.
Okay,
Yeah.
gotcha.
So,
And that's different than Botox?
Botox is a neurotoxin that actually paralyzes the muscle.
Okay.
To what they'll tell you is relax. So that
you don't have the
What
wrinkles.
they'll tell you?
Yeah.
Okay.
But we have recently brought on new technology where we draw your blood, heat it and cool it with proprietary technology, and turn it into a gel. And we can inject it under your eyes. So if you have really sunken, hollow eyes, dark circles, you hate them. That's the thing you look at in the morning and you're like, oh my God, there isn't enough concealer for me to fix this.
Yeah.
We can fill with we call it your own personal brand of filler because it's from your own body.
Yeah.
There's nothing added to it.
Never heard of anything like that. That's
Yes.
amazing.
But what's also cool about it, though, is that PRP, if you're not familiar, platelet-rich plasma, has healing properties.
Yes.
So what they're actually using it in regenerative medicine right now is to heal, for people who have rotator cuff tears. And if you are going to outlive your surgery and need another one, people don't want to do that when they're 80 years old, right? So PRP is taking the healing properties from your own body and the growth factors. And most of the times what they're doing is they're injecting it back into torn labrums and torn ligaments. And it's actually helping to reconnect and heal.
Oh, wow.
It might not be a permanent adjustment or improvement, but at least it buys them time so that maybe they can undergo the surgery when they're 65 and then they'll outlive that surgery and not need another one.
That's
so we're
amazing.
taking it, and we found a recent patient had some blepharitis, so eczema on her eyes, and it went away.
Oh, wow.
Totally away. Just by having the PRP in the area.
Fantastic.
It's unbelievable. So that's my newest passion. I really enjoy doing it. That's love awesome. People being happy. When people leave Soleil and they're happy and they feel good and they're like, yes, this is what I was looking for. I'm like, that is exactly why I do what I do.
I love it.
Yeah.
That's great. Briana, how about you? What is your story?
So I have a background in nutrition and dietetics. So I got my bachelor's from the University of New Haven. I graduated in 2015 and I really did not want to go back to school after that. So I tried not to, but my passion has always been in alternative medicine. It first started off with naturopathy. I shadowed a naturopathic doctor, thought I was going to go to school for naturopathy in Arizona. I noticed she did acupuncture on all of her patients. And I was like, oh, acupuncture seems way easier. Like, let me just do that instead. And then I got into school for acupuncture and had a big wake-up call that it's a whole internal medicine all on its own.
Very complex.
Very complex. So I was so happy, though, I made the decision because I absolutely love it. It's a 2,000 to 3,000 year old medicine. So we're drawing on a lot of these older resources that are still relevant now. And using these basic principles, we can now apply an integrative approach. So like apply more Western medicine on top of them in order to give someone the best care possible. So so nutrition dietetics, I kind of started off there because I didn't have great health as a kid. I always had digestive problems. I always had eczema and a few other things going on. So I always tried to heal myself naturally, like through nutrition. What I realized is that Western nutrition is a little bit limited, just like Western medicine can be. We're very heavily based on this scientific model that doesn't fully encompass who we are as people, because in our modern science, we really like to limit like the variables at play. So we could really study one component.
That's okay.
One component of like one thing going on in someone, and our bodies and our lifestyles just we don't live like that. There's multiple things going on always. So it's very challenging within our current like medical model to understand nutrition and medicine in a dynamic way that people live. So, having the extra perspective of this Eastern nutrition and the Eastern medicine has been life-changing. It's been so amazing. So I feel like I've really been able to like dial in on my nutrition from like a Western and Eastern point of view and give people more the whole picture. So with that being said, I have gravitated toward treating women's health with acupuncture and herbal medicine, treating dermatological issues such as psoriasis, eczema, acne, and digestive complaints. And then, typical like pain. Everyone knows about pain for acupuncture.
Sure,
Yeah. And I have been treating kids lately, which I didn't think I would want to do until later on in my career, but it's been so much fun. So that's definitely another area that I would like to continue to incorporate into my practice is children's medicine.
Yeah, that's fantastic.
So it's been really fun. And yeah, I'm so happy I joined the team at Soleil. It's such a wonderful group of women.
So when did you join? And your role then is acupuncture and nutrition?
So I do acupuncture and herbal medicine, and then also nutritional counseling in general with patients.
Okay, gotcha.
But I joined in March. Yeah.
Okay,
March
so you're pretty new.
So I'm the new guy in the bunch.
All right, that's fantastic. Yeah. So you guys opened your doors in 2020?
That's right.
And what was that like for you? That was a pretty interesting time. I know I opened mine in 2019, so right before.
Yeah, there were lots of emotions, but I think the primary one, so we opened in October 2020, so it was a little late, but also, I guess, depending on how we look at the time frame,
the trajectory.
Right? Yeah.
Right. We didn't know it was
this would go
early,
late.
Yeah.
But what I was seeing was that the primary focus in medicine was if you had COVID, that was what you were being seen for. And then it was like all of the secondary stuff. So like your well visits and your maintenance and all of that was really falling by the wayside.
Yeah.
And I had a family member who ended up suffering from some GI things. And even though she had taken a COVID test and was negative because she wanted to be seen by her PCP wouldn't see her. It could only be a telehealth visit. So from that, a lot of, I don't want to say mistakes, but there were a lot of lack of foresight in a lot of those areas. So she had gotten switched from one antibiotic to another. And a lot of us in medicine know that's a no-no until you finish a course. So she ended up getting C. diff. And so that probably would never have happened had there been that. Ended up getting she had an abdominal CT because she wasn't in a room to get an abdominal exam, which just showed inflammation, right? So that's not going to tell us a whole lot of things, but it definitely put a issue in her bank account, right?
I bet.
And then ended up finding herself in the ED because she was so dehydrated due to the loss of fluids. So like seeing the downstream effects of something that could have been totally preventable, I knew that I was doing the right thing and trying to offer the care to people who wanted it. I also, prior to opening, worked in another office, and I just kept seeing the appointments keep getting pushed and pushed and pushed. And there's already a shortage of primary care providers, and it's about a 6 to 12 month wait list to get an established care with primary care. And so I was in a integrative primary care office. So they were also seeing patients in that capacity, and establishing care just kept getting pushed and pushed and pushed. And I'm like, these people are in limbo. Yeah. And a lot of patients were expressing, despite what was going on with COVID, they were getting very frustrated. And I was hearing the frustrations on the phone. Mm-hmm. They were not happy that they're like, so when am I going to be seen? I want to see the doctor. I don't have a primary care doctor right now. I'm sitting in limbo. Like, what if something happens to me? We were supposed to not overrun the emergency departments, but here we are telling them to go to urgent care and emergency departments.
Right, of course, right? Yeah.
So, but I know that even though I'm not like a frontline, a medical worker myself, I do know that I got into medicine and took an oath to do no harm. And that means that I'm here to support my patients in the way that they need me to, whatever that means.
So what were you doing during that time? Were you actually seeing patients, or what were you able to do?
People wanted to come in.
Yes, people wanted to be seen.
So masking and doing all of those things and just continuing to treat.
If people were sick, we weren't cowboys. We weren't like, all right, bring it on. Let's see if we can.
Of course.
Like we were taking precautions.
Yeah, of course.
But like specifically, like if people were sick with COVID and getting dehydrated, they were like, I need to be hydrated. Yeah. So they were coming in for IVs.
You don't want to sit in a waiting room in the emergency department to potentially get something else while they're there.
Right.
Because we hear that too. Yep. Who's in the emergency room for acute heart issue, and then they catch norovirus because they're sitting next to the woman who has it for 6 hours.
Yeah.
It sounds probably crazy, but it sounds crazy in a bi-directional way.
Yeah, yeah.
So, people wanted to do acupuncture. We gave them the option to do telehealth. They wanted to be seen. People want to be touched. They wanted to be touched. They were missing that human interaction.
Of course.
So,
and there's a lot of things that fell through the cracks during that time, I'm sure, for many people. Yeah. You did look past kind of the preventive care that people needed to continue during that time. So a lot of it was catch up once we opened doors again and got back to life.
Exactly.
Yeah. So there's a huge challenge there. Now, you two are related, right?
Yes.
So tell me a little bit. No, well, you told me before we were officially on. So tell me how that is. How you related?
So Christina's mom and my mom are sisters.
Okay, great. So you grew up together.
Very close.
We're 360 days apart.
Oh, really?
Yeah.
Oh, wow.
Yeah. I'm keeping the math.
Yes.
Yeah.
That's awesome.
Yeah. And Lindsay's an only child, and I have a younger brother. So she often joined, for sleepovers, vacations, summer camp.
Get out of the house.
And you like each other enough to work together.
Yeah.
That's pretty amazing.
Believe it. Yeah, because our moms were in business together.
They were.
Really? What did they do?
They
a
were.
limousine company.
Yeah.
Really?
Yeah.
Oh, wow. That's amazing.
So many months ago.
You're both from Connecticut, right? You grew up here in Connecticut? Okay.
Yeah.
Great.
Yeah. So then it's funny because we meet with our grandfather regularly. He'll be 80 this year. God bless him.
Yeah.
But he stops in the office every Wednesday because he knows that both of us are in the office.
Yeah.
That's great.
Just to say hi, whether or not he's like trying to get anything done. But
he's also a regular.
Yeah.
He's coming in for.
Yeah.
He loves all the things.
Yeah, I bet.
But he's also very business savvy. So we sit down and have impromptu business meetings with him. Yeah. And he's like, listen, this is what happened with with your mothers. Like here, this is perspective.
That's incredible.
Yeah.
What a gift that is.
Yeah.
Because there's doing what you love to do and finding that path. And then when you decide to go out on your own and have your own business, there's a whole other thing you need to learn. So much that you need to learn. I never went to business school, and my background was in acting and in art and all of those things. And it was, opening up a business has been a very long learning process, and it never stops. So that's great to have somebody that you can, learn from and lean on and things like that.
Some of it's old school perspective, but I think that's actually beneficial because one of the things is like most like money and accounting is all like numbers in a computer now, right?
Yeah.
But he's like, no, get an envelope system.
That's not a bad idea though, honestly.
No, because you actually have, and I noticed this with myself is like, it's intangible on a screen,
Yes,
right? And
right.
so like if you can see it and like touch it and know that it's there, and I think there's like some degree of better accountability.
Yeah, for sure. And I think just like when we were talking about health and what people need and how you kind of holistically look, not everything works the same for every person. It's the same way when you're running a business. Not everybody learns the same way. Not everybody processes information in the same way. So not only do you need to learn all the things, but you need to learn all of them in relation to how you kind of interact with them.
Yeah.
So, yeah.
Exactly.
That's great. So what are some of the biggest challenges that you faced since opening your doors? I mean, obviously COVID was a big challenge, but what are you seeing now?
What am I seeing now? Well, I think it's worth noting that we're a cash pay provider in office.
Great. I was going to ask about that.
So
no insurance.
So no insurance so I think that's one of the things, I mean, you guys work in insurance, but like then we're on the other side. And so we actually have a degree of insurance literacy that I didn't think I would have, because I had made the decision early on that I didn't want to accept it in the practice.
Right.
So the primary difference in that is that we don't process it. And so we give you the paperwork to do that.
Right.
And then you can process on your own. We always encourage patients to do it. Some people are like, oh, they're probably not going to reimburse. But I have to be honest with you, every now and again, even though I'm not on the panels, I do get the invoices from the insurance companies saying, we have a mutual patient. This was the breakdown. And they get like almost 90% of it back, depending on their plan.
So they're submitting it for reimbursement.
Yes.
Yeah. Gotcha.
And it goes towards your out-of-network deductible. We also live in a time of high deductibles, right?
Yeah, for
where you're
sure.
going to pay cash anyway. So I think that is probably, I would say, would be probably our biggest hurdle in some capacities.
Yeah.
But also, I think when you are somebody really searching for the thing that you need and this is it for you, you're going to do it.
Yeah, for sure.
And I think insurance also binds us in a lot of ways too, where a lot of patients are like, for example, I have a lot of patients, it seems to be very common with women who have dense breast tissue. So the protocol for insurance is mammogram and then ultrasound. And the insurance companies won't cover the ultrasound unless the mammogram was performed.
Right, yeah.
But these women are coming to me and they're like, well, why do I have to do the mammogram if I have to get the ultrasound anyway? And they're not even waiting a period of time. Like I have a patient who walks down the hallway from her mammogram to her ultrasound in the same visit.
Yeah.
So it's not even like it went to insurance to be approved and then they got, right?
Yeah.
So I think there's a lot of questions on that end too. Is like, and then I get patients when you talk to them, we do discovery calls for patients who are interested in, because they want to know what it's like before they kind of pull the trigger.
Of course.
And the biggest thing is if they are interested in acupuncture, like, well, my insurance covers 12 acupuncture sessions. And I'm like, for what? Like, what is 12? Like, who said that?
That's
12?
like an arbitrary.
Yeah. Like,
Right.
So what, once a month is for what? Like, do you have some specific ailment? Do they know? Like, they're dictating a lot of the policies and the treatment plans. And I've met with colleagues before making this decision while I was still in school. And they're like, so insurance will only pay me out on these codes. But I know that this patient needs additional care so do I go against my ethos because I know I'm not going to get billed on it?
Right.
Or do I lose money on it?
Yeah. Yeah, that's a challenge. I think we help people with their insurance coverage, obviously. And so we try to guide them and answer the questions and coach them as to what questions they should be asking their insurance company. So I think what you're saying too, it's encourage them to submit for reimbursement, because why not?
And
maybe it will be covered.
And maximize your out-of-network benefits.
Absolutely.
We're
sure.
constantly
Those
telling
HSA,
people.
FSAs.
Exactly.
And do you accept HSAs? Okay, so you can pay in that way.
Yeah.
So that's great because it falls under that category. Okay. Great. Yeah. And I think for people that are listening, it's important. I know it's tough sometimes to talk to your insurance company, but call them.
Absolutely.
That's what they're there for. They should be able to describe what is covered and what is the criteria for covering it.
Yep.
And that your provider might not always know.
Right.
Because some of those women that I just mentioned have talked to their providers about foregoing the mammogram and doing the ultrasound. And their providers are on board with just putting in for the referral for the ultrasound. But they've come to me and say that they're on board. And I was like, that's great. I'm glad they're on board. But now you need to call your insurance company and see if they're going to cover that procedure.
Right.
And sure enough, they're not.
Yeah.
Because they need the mammogram in order to do that.
And it is a process.
Yeah.
And sometimes they're going to get a denial letter on something. And all that means is you call your provider at that point and you say, we put you in touch. Can we make the communication go? And they can try to figure out if it's covered or not.
Yeah. And then the other side of that too is, oh goodness, I think I lost my thought. Sorry, we'll come back to that.
That's okay. That's okay. I kind of interjected there for a second because it is something that we're very passionate about because it's one of the areas that is such a mystery for people. It's such a confusing thing. They don't understand how much their insurance can do for them. And it's important to, be able to utilize it as much as possible.
Yeah, actually, so I just came back to my thought. Is also because my mom was also complaining to me about something. She had gotten hit with a bill after her annual physical. And she's like, but this is supposed to be included in my annual. And then I got this bill from someone else. And I was like, well, did you check with your insurance company that they would cover it in advance? And she's like, well, no, it's supposed to be a part of my annual visit. And I was like, unless it is that, and it sounds crazy saying the zoo code, the Z00.00, which is an annual exam without abnormal findings. It's not. And so I always, and because again, I understand the sensitivity around finances and especially when you're paying me already in cash, I don't want you to get any unexpected bills. So I'm constantly telling patients, if we're going to order tests that are maybe a little weird, call with the insurance company, see if they're going to cover it. And I do have patients who said that they've gotten the go ahead and we order it and then they don't cover it. And then it's another conversation, but at least it's on the record.
Yeah, for sure.
So
there's only so many things you can do. Everything is a process, but it is worth going through those processes.
Yeah. And we're constantly trying to encourage them to do that.
That's great. That's
and
awesome that you're able
understanding
to do that.
if you have like a high deductible, right? So just going to the doctor, you're paying, and even if it's a covered service, you still have to pay toward that deductible, whatever percentage it is.
Of course,
right. And so
if we're out of network, I mean, you're going to pay right anyway.
Even in network.
No, but I mean, choosing to work with us. If you're maybe one person and your deductible is $1,500 for the year and you're generally healthy, not on prescriptions, there's a likelihood that you're not going to achieve that deductible.
Right.
So every potential office visit you go to, you're going to have to pay anyway. So we're like, well, you can come here and at least we'll contribute to your out of network deductible. So God forbid something happened.
Right. Yeah.
But you're going to pay anyway, right?
For sure. And a lot of things are based on medical necessity too. So sometimes it's just the insurance company saying, what's the necessity? What's the reason for it?
Yeah. So we do have to write letters sometimes.
Yeah. That's great. That's great that you support your clients in that way.
Absolutely. If it is a reasonable thing that we are doing that is medically necessary, like we're filling out the forms to help support our patients and advocate for them.
That's fantastic.
Like if we have somebody who comes in with chronic fatigue syndrome and IVs every 2 weeks are helping that person, you better believe I'm filling out a letter of medical necessity.
Yeah.
Because I am seeing with my own two eyes that clinically this person is improving with this treatment that may not be traditionally covered by insurance. But hey, if they can use their FSA or their HSA for that, why not? Yeah,
absolutely. Now, how big is the team at Soleil? Do you have support staff at all, or is something sensitive?
You're looking at them.
We support.
I had a feeling.
Well, also, I think something that we inherited together were control issues. So there's a lot of like needing to know where the things are and all. And I think sometimes it's not trying to be micromanager, yeah, but it's more so wanting to have a pulse on the entire situation, because I sometimes was an experience where I found out later down the road that like maybe something wasn't handled appropriately, and I give a huge credit to offices who can hire support staff who act autonomously to make decisions on behalf of the practice. But for me, again, going back to the fact that we're a cash pay model, patients are choosing to work with us. Yeah. And it's just like if you open the door, first impression, you only have one chance to do it. And it's the same thing on the phone. So if you call our office and you're totally turned off by that, it's going to ruin the rest of it. It's a domino effect.
I can totally understand that.
So that's part of it. We're looking for a unicorn, and we know that. But at least we're having realistic expectations along those lines. But as far as providers are concerned, we are technically 4 providers, but we also have a registered nurse in the office too.
Gotcha. Okay. And then do you have a collaborating physician as well that is
no, because she can
not
act.
necessary.
I'm autonomous. Yep.
Gotcha. We just learned all about that in one of our last episodes.
I saw that.
Yeah.
Yes.
Yeah. So
I've been practicing long enough in Connecticut, and
that's fantastic.
Essentially what they do, their malpractice covers and all
of course.
that.
Yeah. That's great. And you had mentioned something about a discovery call. So is this kind of the first interaction somebody would have with you and your team?
Yeah, if somebody is unsure. I did a lot more discovery calls, I think, in the beginning of practice. And now I don't know if it's just a confidence thing, having an established, track record, something along those lines. But it gives patients the opportunity to ask some of the questions. No treatment is discussed in those conversations because we're not in a doctor-patient relationship.
Right.
Essentially, let's say if somebody is coming in, they have maybe they're interested in I do a lot of fertility in my practice. So maybe this woman and her husband are having trouble conceiving, and they've exhausted all of the interventional modalities through IVF, IUI, medicated cycles, that type of a thing. And they're just feeling very depleted and want to know what this would look like for them. And so the discovery call runs through, this is a potential plan for us. This is what I would do. I would like to run labs after our first visit, et cetera, et cetera. And then they either feel comfortable with that plan or they don't.
Gotcha. Okay. Yeah. So this is a complimentary discovery call.
Yeah.
And could it be for anyone who comes across you and says, hey, this sounds interesting, but I'm not sure exactly what I would need?
Yeah, that's exactly it.
Okay. Gotcha. All right. And how do people find you?
Are you asking like for our information, or are you asking how the general consensus of
both,
how people
actually.
find it? Yeah. So we have a website. We also soleilholistic.com.
Yeah, I'm on it right now.
And I always that was a big thing. I always have certain goals. And one of the goals for this year was capturing how people have found us.
Yeah.
We're at that, what is it, 2020? It's 2024. So we opened, we'll have our 4th year anniversary in October. And so the word that to me was about the 3.5-4 year mark is when it's mostly word of mouth. And I have to say a lot of patient base right now is word of mouth.
Yeah.
But we do get a lot of Google.
Yeah. Some cold calls.
Yeah,
okay.
Exactly.
That's great.
Yeah.
So, and they felt comfortable enough having looked at our website to pull the trigger and make the appointment.
So you would encourage people to go to the website to learn more?
Definitely.
Yeah, there's a lot of information there. We do a lot of things, as you mentioned. So it gives, I think there's a lot of good descriptors in there.
Yep.
We've updated bios. The idea is that we want patients to walk through the door having felt like they've been there before. And so that's the environment that we've tried to create on our virtually.
And you're located in Hamden, Connecticut.
Yeah.
Okay, great. Yeah. Now, what are your goals for the business? Do you kind of, where do you see it going?
A current passion project right now is corporate wellness.
Okay.
And so what we're doing is we're taking the principles that we practice with our patients individually and trying to enhance that in a corporate setting. Because as we know, an efficient workforce and a healthy workforce is going to be the most productive workforce. It's not even just about health from a physical lab standpoint, but it's also mental health. It's employee satisfaction in their jobs, those types of things. And so that's really the direction that we're headed in. And I know that a lot of organizations have, the health insurance aspect, but I think there's a huge, I want to say maybe fuzzy line.
You're also relying on, like with some of those incentives that they have set up, you're relying on your employee to do it. When you're setting up something like corporate wellness, you're saying, no, I'm bringing that to you. Mm-hmm. I am making it accessible to you. I value you. I see you as a person. Mm-hmm. You're not just a task monkey here. And I'm investing in your health and wellness.
Yeah.
So we go on site.
Yeah.
And
so,
that's the point.
Okay.
Mm-hmm. Yeah. And there's lots of different options that looks like talks to give some people information on gut health, women's health,
sleep.
What does sleep look like? Mm-hmm. And then kind of breakout sessions that might be some of the aesthetic stuff that I do. Maybe, some mini aquafacials, community acupuncture, some guided, body work that Briana's so great at. We kind of dipped our toe in this pond earlier this year. We did a teacher appreciation event where
that's great.
We went we ended up staying for 5 hours, and we had 3 stations set up, and we did gift bags with all little self-care things. Yeah. And then they could partake in any of the breakout things. And it was so cool. And everyone enjoyed that day. Mm-hmm. And it was this can definitely translate to a bigger model for sure.
Do you have a certain size group that you're looking at? I mean, would you do small businesses or?
Absolutely.
That would be
You
the
would.
primary
Yeah.
target, but
Yeah.
I think up to like 100 employees.
Gotcha. Okay.
That was really when I drafted the framework. It was actually based off of a client that my boyfriend had, was about 100 employees at the time. And so that was kind of like the ideal client. And I figured out what that would look like.
Yeah.
And so we're actually working with a company of 40 right now.
Oh, wow. That's great.
Yeah.
Fantastic. And so it could kind of be on top of their existing health insurance plan, or maybe, I know a lot of small businesses aren't able to offer health insurance to their employees. Maybe
Right.
it's in lieu of
Yeah.
while they're growing.
Exactly.
Absolutely.
Yeah.
Yep.
And it's
Gotcha.
a whole curated day or multiple days or whatever. So, and it can look like our biggest thing is if it is a reasonable request, we will not say no.
Okay. Gotcha.
We are medical providers and we want to take care of people, but we are also business women and we want to see
Human.
this business grow. It's our passion project. It's
Yeah.
something we feel very strongly about. And so if you're like, I don't know, I have this crazy idea, and we're like, yeah, if it's reasonable, we'll figure it out.
Yeah,
And that
fantastic.
extends to the providers in the office too.
Yeah.
So I meet with Briana regularly to see, hey, like what's going on? How can I support you? Any ideas? Because I think having ownership over something that you do is super important, and it gives it satisfaction.
That's great. Now, Briana, how does your work within Soleil work? Are you out there bringing in your own clients? Are they coming and finding the whole organization? Do you guys kind of walk patients to each other or clients to each other?
We have a big collaborative network
You do?
inside of the office.
Okay.
Yeah.
Yes, that's
Gotcha.
very important for us.
Yeah, so I've been doing a lot of networking through the office and
Yeah.
just trying to put my face out there, do different talks. I was on Wow Radio a couple times. That was fun doing this, but just kind of letting people know that I'm here. I've also been doing one publication a month for the website or for a magazine
Oh,
or a
that's
blog
great.
post, just to kind of synthesize what I'm doing and
Yeah.
in little more bite-sized pieces. I tend to overwrite, so working on that, but I just have a lot of great things to say. So
That's awesome.
yeah.
That's great.
Yeah.
And people can access that from our website. So we are
Okay.
very passionate about writing.
I do see a blog link here.
yes.
That's the blog?
Yes.
Okay, great.
So we write for our blog, Natural Nutmeg, other
Other websites.
websites, exactly. So anything that's kind of interesting to us that
Yeah.
maybe we've been thinking about that we're like, probably if I'm thinking about it, other people want to know about it.
Yeah, that's awesome.
Yeah.
I love that.
Yeah.
We'll
So-
definitely check that out. So, the last part of our podcast is usually talking about maybe some of the individual practices that you all have, ways that you keep yourself healthy. So are there different things that you do to stay healthy and kind of, have a practice to kind of keep yourself going? We can start with you, Briana.
So I do a lot of internal medicine practices in terms of like physical exercise. So I do Kung Fu. And
Awesome.
then Qigong and Tai Chi. So it's a lot about getting stronger from the inside out. Helping with like the organ dynamics with digestion and just the way the internal body is working, and then out to the skin. So I do a lot of that. And then I just try to stick to some basic traditional Chinese medicine diet principles, like try not to, and these are guidelines. I do not do these things 100% of the time. There's always exceptions, but
Disclaimer.
You are a human being.
yeah. Like, for example, it's important to sit down when you eat and not stand up or not eat in the car. And so that's a Chinese medicine diet principle, but we
Guilty
can
of all of
relate it
that.
to Western medicine because it relates to the nervous system. So you have your rest and digest, parasympathetic nervous system. And then you have your fight or flight, sympathetic nervous system. So you want your rest and digest nervous system to be activated. So all the blood and energy is going into your digestion. if you're in fight or flight mode because you're driving, you're standing, the blood is being shunted out to the legs, to your head, to your arms, so you can do whatever actions, and that causes your food to just sit there more.
Right. Yeah.
So then when food sits there, I'm sure we've all had an experience of throwing something out in the garbage and food's just sitting there, it starts to rot. So every time we eat something, our immune system is also activated. So it's killing off whatever potential bacteria, whatever intruders have come in through the food. So when the food is sitting there, your immune system is just continually activated, because now as the food is sitting, it's allowing more bacteria to harbor and grow.
Yeah.
So it can lead to food allergens, digestive problems, and even down the line, long-term sort of autoimmune conditions, because your immune system is always activated. So I think that's probably one of the main things. And there's some other diet principles I don't want to
Yeah. That's really interesting, though, because I do hear a lot about being more aware when you're eating, right?
Yeah.
Like focusing on that fact, and it will help you to eat less and eat what you need. So I do find that really interesting.
And there's some real reasons behind that. It's not just some fluffy, be mindful. No, actually, wherever your mind goes, your energy flows.
Right.
So if you are focused on your food, focused on your digestion, that's where your energy is going to get the most nutrients out of your food.
Yeah, it's similar to when you're trying to multitask and you're doing 3 or 4 things at once, you're not doing anything really well.
Yeah.
So eating and digestion, it's one of those things. Yeah. That's awesome. Christina, how about you?
I walk every day.
Fantastic.
That's my time with my husband and my dogs.
Nice.
Yes. I do a massage once a month. That's a non-negotiable.
Cannot miss.
Yep. I get a massage once a month.
Got it.
And I do apple cider vinegar every single day for my digestion. And I try to limit foods coming out of a package.
Okay.
So trying to cook a lot of whole foods.
Yeah.
And I would say, so that's what I do personally. As a medical provider, I've also made it, as I've gotten older and more comfortable with myself and my practice, I've also made it a point to talk to people about things, right? And it's so funny because I'll have people be like, well, I'm embarrassed. I don't know if I should be talking to you about that. You're a young lady. And I'm like, there's nothing I haven't seen or heard. So let's talk about it. Are you pooping every day? Okay. What does your sleep look like? Right? Are you having symptoms? Okay. How is your libido? Please don't be ashamed to talk to me about that. All right.
Yeah.
Because that could be a symptom of something that we can address. So I have gotten a lot more comfortable, and I make it a point to have these conversations with people because stuff starts to come out.
Yeah. Right.
And then you start being like, okay, I had an anchor bias when I thought I knew what I was walking into, and it totally shifted because we actually just had a conversation.
Oh, yeah.
I'm going to jump in right here. I love the conversations I have with my friends that are nurse practitioners. They learn really early. You better get comfortable with this right now.
Absolutely.
Yeah, right.
Absolutely.
You're not on microphone right now, Joe. So. All right. And Lyndsey.
But that is also the same principle. I have patients come in and saying, this is probably TMI, and they start talking about bowel movements. I was like, no, I want to know all of the details.
Yeah.
And because it's the best impression from the inside that comes outside, right?
Yeah,
I mean,
for
without
sure.
trying to be super crass, but yeah, it's the truth. So
it is never TMI
No,
for
it's
your
never-
providers.
for your provider, exactly.
It's funny. I
cannot
think
stress that enough.
I think it's natural for all of us to try and hold on to this idea of dignity that we have, right? But when you start to have health issues, there are certain things you want to let go of. And even before then, I mean, I think that's a great practice because we need to be talking about all of those things. They have to stop being, the non, talking, keeping silent, all of that. You can't, because otherwise you're just kind of pushing them to the side, and they might be a part of a bigger picture.
Absolutely.
Yeah, that's one of the principles I have in one of the conversations I talk about on gut health is it's not just what you eat, how you eat, and when you're eating, but it's also the what you were exposed to as a child. And my biggest conversation is about school. You're on a bus. Chances are on the bus at 6:30 in the morning. So you probably, if you didn't eat before then, but if you did, chances are it was cereal, high sugar cereal in like what we thought was healthy, low fat milk. Right.
Special K and skim milk.
Exactly. And that's if you had the time. And if you did have the time, it was like 10 or 15 minutes. And then you're running out the door to the bus that doesn't allow you to have food on it.
Yeah.
And then you get there and you get to school. You're not allowed to have food in the classroom. And then around 12 o'clock, the bell rings for lunch and you rush down there to see that if you can get in line. And by 12:25, the bell has already rung to go to your next class. So you're shoveling food in your mouth. Not only that, you have to raise your hand to go to the bathroom. Talk about lacking dignity.
Yeah, right.
So all of these things psychologically then contribute, I think, to future adults who suffer from GI issues.
Yeah, I think you're right. That's really kind of incredible. I never really thought about that.
So there's a lot of, I think, conditioning as a child that plays into that. But
Yes.
as
What
my
you do.
practice,
Yes,
I
what do
mean,
you do?
I am making sure I'm going to the bathroom every day.
Every day. Everybody needs to be pooping every day. We cannot stress that enough.
I read that book to my kids.
Yes, like please talk to us if you are not.
Or when people come in, they're like, yeah, how are your bowel movements? Oh, yeah, they're fine. So you're going every day? Like 4 times a week. I'm like, oh, no. You're grumpy when you don't go to the bathroom, right?
Yeah, you're not detoxifying.
So for me, it's actually prioritizing sleep. So I live about 50 minutes from the office. So I'm driving roughly 2 hours a day. And so sometimes that means I'm getting home at late. But that means that I'm always trying to make sure that I'm also establishing boundaries, both in work and personally. And so for work, what that looks like is shutting the computer off at 6 p.m. and that's it, and not looking back. So I do that so I can limit the screen time in the evenings, be more present with my partner and our dogs and anything that we have going on, and then making sure I go to bed at a reasonable hour to at least get 7 hours of sleep. If I don't, I do sleep a little bit later in the morning, and I don't have any shame in that. And this is actually a shout out to all of those warriors who think that they need to get up at 5 o'clock in the morning to get to the gym. No, you need to sleep. You need to sleep.
Yeah.
If you're getting less than 5 hours of sleep, I mean, honestly, I think if it's anything less than 6 hours, you should not be setting your alarm to go to the gym because that's the only time you can go. It's okay that you missed the gym that day, and I'm giving you permission.
Well, thank you. I appreciate that. But I have been hearing more and more about that and how we all should be prioritizing sleep.
Yeah, we have a stress issue in this world too, right? We're constantly talking about how stress is the silent killer and all of these things, right? No one really talks about the pathology of that, and I'm not going to get into it because it's a lot of details. But in the end, and we also think of cortisol as a stress hormone, but it's also the survival hormone. And so if you are in survival mode, you're going to constantly be secreting cortisol, which is going to be deleterious to your health. Back to what Briana was saying is predilection of autoimmune disease is 80-1 in women. Women are caretakers. They give, they don't take.
Right. Yeah.
And so then most of the time, those are the women who are trying to be the morning warriors, and they're running back and forth because they have to take care of their kids. So they're trying to get in the me time, but really the me time is just probably not doing a whole lot and just decompressing and sitting with your emotions.
Right. Yeah. And we have to stop thinking of sleeping and resting as lazy.
No.
Because that's
it's
rest,
necessary.
recovery. It's important for everything. I mean, processing our memories and repair.
Yes.
Yeah. I mean, even when
important.
when you consider things like dementia and Alzheimer's disease, I mean, there's enough white papers out there that are supporting the fact that recently we have something called a glymphatic system, which is the brain has its own garbage disposal area. And they've only recently found that. And the predilection to the Alzheimer's dementia is that you have these plaques that are developing on your brain. The jury's not sure if that's a protective mechanism and then it has downstream effects, right? But the priority there is saying that your glymph system is working when you're sleeping. So if you're not sleeping, that glymph system is not on.
Yeah.
And so then you're just setting yourself up for a whole host. So
yeah, absolutely.
Best thing is if you're no good to yourself, you're no good to others.
Right. Yeah, for sure. Well, this has been such a great conversation. I feel like I want to get each of you in here, individually, because there's so many different things to talk about with each of you. So, maybe we'll find a way to have you back on the show. But I really appreciate you being here, taking the time out of your very busy days. I think, what you guys are doing with Soleil is incredible, and we'll definitely make sure we tag and post and share information. So if there's ever anything that we can do for you, please reach out and let us know.
Okay.
Great. Thank you.
Okay?
Thank you.
Yeah.
And, we appreciate you sharing Sounds of Health and getting the word out there. I do want to thank everybody who's on Facebook Live. I don't know how many people we had. We have a few. Okay, so
Nice.
7's about our usual for these things.
Yeah.
But if you are on there, please share all of this. Don't keep us a secret. We're trying to spread the sounds of health out there and get more people to be aware of the resources in the community that can help all of us to live a healthier life. So thank you all for joining us today. Thank you guys for being here. We really appreciate your
Thanks.
time,
Thank
and
you.
we'll see you again.
All right.
Thank you.
Thank you.
Thank you.
Sounds of Health is brought to you by Nutmeg Insurance Advisors and recorded at the offices of Nutmeg Advisory Group. The podcast is produced by Jason Carubia and Dave MacNiven with music by Rob Hames. You can find us on Facebook, Instagram, YouTube, X, and wherever you listen to your podcasts. Your support means a lot to us, and we appreciate it when you like, subscribe, and leave a review. If you know someone who you think should be a guest on the show, please email us at soundsofhealthpodcast@gmail.com. Each week, we help you move the needle toward better health by spotlighting the stories, people, and resources that inspire and motivate others, and we are just getting started. Help us share these sounds, and don't keep us a secret.